Hi, everyone. Lori Marie here from the Mental Health Association of Rhode Island. Today, I'm joined by a very special guest, Quinten Foster, who will share with us the unique challenges faced by transgender Rhode Islanders and what allies can do to help and support them. So please give a warm welcome to Quinten Foster. Quinten is the Director of Transgender Whole Health Care at East Bay Community Action here in Rhode Island. Welcome, Quinten.
Thank you so much for having me, Lori. So my name is Quinten Foster. My pronouns are he, him. I am the director of the new Trans Health Care program at East Bay Community Action program, starting off in Newport, Rhode Island.
That's wonderful. Can we start with that? Can you tell us a little bit about your program at East Bay?
Yeah, so East Bay Community Action Program is a health and human services agency. So we serve the entire East Bay area from East Providence through Bristol Warren, Aquidneck Island, Tiverton, Little Compton, and Jamestown. We provide primary health care, mental health care, recovery supports, dental care, and a wide range of human services like Head Start, WIC, senior services, food pantries, career closet, even tax prep for low to middle income families in LIHEAP. We have tons of services. But our new transgender health program was founded this past year over the summer to fill some gaps in care for the LGBTQ community with a strong focus on gender affirmation. We're still developing our full spectrum of services. So what I share will be more related to what we currently have available, and we can talk a little bit about our goals for the future.
That's wonderful. I'm really excited to dig into this, and I'm really excited to share this resource with other Rhode Islanders. Can you tell us a little bit about your story?
Absolutely. I can share a bit about why I've chosen to be what we call publicly trans while working in the mental health and human services field. We definitely don't have time for my whole story. So one of the important pieces of why I'm so very open about my transition is because I didn't have a whole lot of support when I first came out. I came out as a young adult around 18 and didn't really have any connections with my family that went past that coming out period. Unfortunately, I experienced being kicked out and homelessness and kind of trying to figure out the entirety of how to be an adult on my own while also working on that gender confirmation experience and journey. So it was really difficult. I didn't know any trans folks that I could look up to and ask questions. So all of those things that young adults tend to learn on their own with all of the support of like family and even a lot of times peers. We're learning a lot of things from our peers at that point. I didn't really have peers to ask. So I was on YouTube, I was on the internet trying to learn all of these different things and find myself resources. And I really don't want any other trans youth to have to go through that. So I try to position myself as a really visible advocate and ally so that people know there's someone to come to.
Quinten, thank you so much for sharing all that. I really admire your strength and your courage and how you are now supporting and sort of mentoring other transgender young people and helping them along their path. I really appreciate what you're doing.
Thank you. It's such a rewarding experience.
As an ally, I wanted to touch base with you about terminology. So LGBQT plus terminology is new to many of us. And even allies who are supportive and well-intentioned sometimes get the language wrong. Can you please define some of the most important terms and what terms or language is now considered outdated?
Right. So language is one of the questions that I get, or one of the topics that I get the most questions on when I do trainings. And that's because the language that's considered respectful and appropriate changes all the time in the LGBT community and in just healthcare and human services in general. Our vocabulary is always updating. So some of the most important terms that I tend to go for, obviously the first one is just transgender. So transgender is an adjective. It describes someone who does not fully identify with the sex they were assigned at birth. So for example, when I was born, a doctor looked at me and said, "This is a baby girl." And when I got old enough to have the language to tell them they were wrong, I did, because I don't identify as a girl. So that makes me transgender. The quote unquote opposite of that is cisgender, which is someone who does fully identify with the sex they were assigned at birth. So this covers somewhere between 95 to 97% of the world's population, according to current statistics, although we know that those are limited. And then non-binary is another big one that I talk to people about. So non-binary is another adjective that kind of describes someone who falls out of the just male or just female options. So if we've got two checkboxes, this person doesn't really pick either of them. They could not really identify with gender at all. Some people might consider themselves agender if that is how they feel. They may feel like their gender is really fluid and it fluctuates from time to time. Or they could just have a descriptor of their gender experience that doesn't really fit with our Western binary descriptions. So that's an important one. Pronouns is another important one. So a pronoun is a small word that we use so that we don't have to keep using somebody's name over and over again. People tend to struggle with these with the trans community because in English, most of the time we use he or she, and a lot of trans and especially non-binary folks don't use he or she. They may use they, them pronouns, they may use multiple different sets of pronouns, or they may use pronouns that people aren't really familiar with. We have a lot of what we consider neo-pronouns, which either come from a different language or were created to kind of describe a gender experience that doesn't fit into a he or she category. So that's another really common one that we go over. Gender dysphoria is pretty important. So that is the experience that most trans folks have where either their body or social perceptions of them or social like gender roles don't align with their understanding of their gender internally. So this can cause a really deep discomfort with all of those things. It's really important to kind of clarify that not every single trans person experiences gender dysphoria, and we don't all experience it as kind of like a continuous thing. Myself, for example, I had a lot of dysphoria around my chest before I had top surgery, but now that I have had top surgery, it almost never bothers me. So it can be kind of a fluid experience. Gender affirming care is another important one. A lot of people have heard this term in the news recently, but this really is any kind of care that helps someone feel more comfortable in their gender. And the important thing to recognize is that gender affirmation is not just for trans people. So every single person experiences some sort of gender affirmation, and most people do it on purpose. So for example, a lot of cisgender women feel more pretty and feminine when they wear makeup. That's gender affirmation. A lot of cisgender men feel more masculine and more confident if they go to the gym a lot, they build up their muscles, they wear a specific type of clothing. That's gender affirmation too. So it's not just trans folks taking hormones and changing our names and stuff that has to do with affirming people's gender. And then the last one is transphobia, or something being transphobic, which is this description that we use that can get really complicated. When we use a phobia term, a lot of people consider it a fear, which if we're thinking about mental health, that is more related. But when we're thinking about transphobia, it is more about the stigma, the stereotypes, and the negative association that we have as a society with anything related to trans people. And so when I say something is transphobic, that means that it's really not celebrating the experience of trans folks and that it's increasing that negative stereotype associated with us.
Are there any outdated terms that allies should stop using, and why?
Definitely. So a couple outdated terms, transgendered with an ED at the end. Because transgender isn't a verb, we don't put an ED on the end ever. It's not something that happened to me, and it's not something that I did. It's a descriptor that describes the type of man that I am. So it's a transgender man rather than transgendered. A lot of people get that one wrong just because it's an unfamiliar term. Sexual reassignment is another one that we don't really use anymore. That used to be the term that folks would use for gender affirming surgeries on the genital area. We don't use that anymore. We use gender affirmation surgeries or gender confirmation surgeries. Those are just a little bit more positive. Transvestite or transsexual. These ones are complicated because there are folks who still use them in regards to themselves, but they should not ever be used in regards to somebody else. So these are old terms that used to reference transgender people or people who have had differing gender experiences, whether that be in clothing or medical care, etc. We just use the word transgender, non-binary, or gender expansive at this point. And then people will use some phrases that are a little outdated sometimes, like deciding to become trans. It's a lot better and a little easier just to say when the person transitioned, or preferred pronouns. Pronouns are not preferred, they are a requirement. So you can just cut the preferred part right out of there and just say, what are your pronouns?
Do you think people should have a practice of asking everyone they meet, what are your pronouns?
I think it's a wonderful way to be able to respect that person in a very easy way. So when you very first meet somebody, the easiest way to figure out not only how you should talk to them appropriately, but how you should talk about them appropriately is to ask what their pronouns are. So when I introduce myself, I always say, hi, my name is Quinten Foster. My pronouns are he, him. What do you use? And that allows them to give me not only whatever name that they typically use, because they may have a nickname or a different name that they don't like to go by their legal name, and it gives them an opportunity to share their pronouns as well.
Thank you. You alluded to this earlier, but I want to pick up on this thread. How many Americans consider themselves to be a transgender man or woman? And why is it hard to really nail down those precise numbers?
Right, so we don't know exactly. And the difficult piece about this is that we don't have one single place to collect the information. So your gender identity, especially in regards to being trans or belonging to the LGBT community, isn't something that is collected very often and in one specific place. It's not on the census anymore, so that makes the data pretty difficult to access. We do have a pretty detailed large-scale survey of the trans experience that happens in the United States, but unfortunately, it doesn't happen that regularly. We had one, it's called the USTS, so we had one that happened in 2015, and then we just finished collecting the data for the 2022 version of the survey, but we don't have access to that data yet. So hopefully sometime this year, we'll have some more updated numbers. But even that is difficult because it's self-report and it is based on whomever realizes that the survey is an option. So sometimes with advertising and marketing and stuff, we just can't really collect the whole community. But with all of that being said, it is estimated that the adult population of trans folks makes up about 2 to 5% of the US adult population, depending on who exactly you're including in that statistic. With youth, it's a little bit higher. It's probably between 5 and 10%, depending on which research you examine.
Thank you. So now I'd like to talk about what are the biggest challenges facing transgender Rhode Islanders today?
So the biggest one that comes right off the top of my head is there's a lot of anti-trans legislation going on across our country. Unfortunately, that is dramatically impacting the mental health of trans Rhode Islanders, even though there's relatively little negative legislation here. So people are seeing this in the news, they're seeing it on TikTok, on all sorts of social media. There are sports bans for youth. Trans youth are not being able to be included in the sports that they want to play in their public schools. There are schools that are being required to misgender their transgender students because laws are being passed where teachers are not allowed to use students' name and pronouns as asked. They have to refer to them as what's listed on their birth certificate. There are some places that are requiring DCYF involvement for parents who are affirming their trans children, or places that are requiring doctors to not even be able to give referrals for gender affirming care, let alone provide the gender affirming care itself. There are a lot of attacks going on across the country for our community, and it's a big problem, even though not a whole lot of it is occurring here in Rhode Island. It's still really scary. There's also, unfortunately, a lot of anti-trans violence that goes on in the world. Every year we have an event, the Transgender Day of Remembrance in November. And this year we had over 200 trans folks who were killed just for being trans. Every year, a lot of us get together and we'll read off their names, tell their stories, and try to honor their memory as much as possible. But we are being attacked and killed at painfully high rates. One event that you may recognize the name of, the Club Q massacre this past year. All of those things really are very strongly related to transphobia and just discrimination that happens against our community. And then the last piece is a real lack of access to gender affirmation. There are not a whole lot of providers of transgender healthcare. There's not a whole lot of representation in the media, in government, healthcare, sports, education. It's really hard to find a trans person to look up to that you know is trans and speaks about it openly. There's a lack of housing, there's a lack of job protections, there's constant and pervasive binary gender expectations and stigma. All of this really just negatively impacts not only our opportunities as trans folks, but it impacts our mental health negatively just by experiencing a society that treats us this way.
Thank you. Are there any misconceptions you would like to clear up while you have this opportunity?
Definitely. So being trans is not a new thing. It's not a fad. We are so incredibly lucky to have access to the internet. So now more and more people have access to the language that they need to describe their experiences, their identities. A lot of folks comment very similarly to the way they comment, oh, everybody's autistic nowadays. Everybody's transgender nowadays. But that's not really what it is. Trans people have been here since the beginning of time. What's changing is that there's a little bit more societal understanding, a little bit less stigma, a little bit less physical danger for coming out and being your authentic self. And people are able to finally share their experiences. So years and years and years ago, if you were a trans person living here in Rhode Island, you probably had no idea that there were dozens of trans people all around you because there was no way to really connect to each other without risking your own safety. Now we have the internet, so we can share terms and experiences and, oh my goodness, this doctor over here is really affirming, actually provides me the care that I need. And so people are feeling a little bit more comfortable being themselves. The other thing is about puberty suppressants. So a lot of adults, especially those who are worried about trans youth, tend to think that puberty suppressants are dangerous. This is not the case. Puberty suppressants are a really amazing tool that we have in our medical tool bag that allows a child who's around the age of puberty and they're adults in their lives to kind of just press pause on puberty for a little while so that they have a little bit more time to explore their gender identity, explore what they're going to do next, and choose what type of puberty that they're planning to go through. So someone, for example, a child assigned female at birth who does not want to grow breasts, does not want to get her period, all of those things that come along with puberty, could go on a puberty blocker and have some extra time to decide, am I going to go through an estrogen-based puberty? Am I going to go through a testosterone-based puberty? How will those things impact me and my family? What kind of support do I need while I go through either one of these puberties? So it just gives people a lot more time to figure it all out. They're safe, they're effective, they're life-saving, and almost every single piece that comes along with puberty suppressants are reversible. And they're actually used in cisgender kids as well. So for example, if you had a young child assigned female at birth who started with their menstrual period at 6 years old, we don't want that. We don't want 6-year-olds experiencing periods. They don't need to experience that yet. So that child would go on puberty suppressants as well. It's not just for trans folks.
Interesting. I had no idea. Thank you for that information. Do you have any advice for other transgender men and women out there? What would you tell them if you could speak to them?
I think the biggest piece of advice I can give to the trans community right now is just to stay alive. Do whatever you have to do to take care of yourself, to stay safe, and to thrive to the best of your ability. Reach out for support if you need it, provide support to others when you can, and engage in actually meaningful self-care, whatever that means for you. Other folks in our lives and our allies really need to recognize that trans folks are not always safe to come out or live authentically. Our homes, our jobs, places of worship, and even the streets we walk down may not be safe for trans people. And staying in the closet does not invalidate somebody's identity. And not seeking medical transition does not make somebody less trans. So really understand that self-care and making sure that you're taking care of yourself before anything else is my biggest piece of advice right now.
Thank you, Quinten. What can allies do to help our fellow transgender Rhode Islanders? If you could give a few action steps for maybe daily practice, those that might have a big impact, any specific situational responses, I'm sure our listeners would greatly appreciate knowing a variety of ways to be an active ally.
Absolutely. So we'll start with the daily practice. One of the best things is to practice gender neutral language and introducing yourself with your pronouns like we talked about. Put pronouns in your email signature at work or at school. Put them on your personal email. Follow trans creators on social media. Watch media that focuses on trans stories or has LGBT representation throughout. Purchase representative media for your children and educate them on diversity. There are even books that are made for pre-readers so that parents can have diverse books about all sorts of diversity topics that you can read together, and you can make a really wonderful learning experience for both child and parent. One of the more big impact things you could do is to donate to trans supportive organizations. For example, the Trans Lifeline, Trevor Project, the National Center for Transgender Equality, Youth Pride Rhode Island, the TGI Network, House of Codec, PRISM, or your local trans healthcare program. You could volunteer as a host for PRISM's REST program to provide emergency landing for queer and trans people of color who are experiencing homelessness. You can advocate and vote for trans rights and protections in the legal system. You could even bring a trans-focused learning opportunity to your workplace, your place of worship, community organization, school, etc. These are some of the things that both our trans health program and the trans health program at Thundermist provide. And then some situational things. It's really important to correct people when they misgender someone, even if that trans person is not there, is not your loved one or patient, or doesn't complain about the misgendering. Making a point not to out people ever is really important, but I know we all just went through the holidays and probably heard a lot of really difficult conversations. So sticking up for trans people and trans rights when your ill-informed loved ones discuss them in a stigmatizing way is also really important. And then intervening if you see somebody being harassed in public because of their gender expression, identity, sexuality, relationship, etc. Being an upstander is a really important piece of allyship for the trans community.
I like that, upstander. That's great. What is your biggest takeaway message, or perhaps messages that you would give to people who consider themselves allies of the LGBTQ plus community? Many of us, we hold respect and love in our hearts, and we're with you all the way. But maybe we're not outwardly participating in advocacy efforts. What message do you have for us?
Absolutely. So ally isn't really a title that someone can give themselves. It's an earned title. Mm-hmm. So allyship in times when people are being segregated, attacked, separated from their families, and murders is not theoretical. It can't be. You can support the trans community in your heart. You can love us. You can do all of those things, but to be an impactful ally, you have to act. As philosopher John Stuart Mill said in 1867, "Let not any one pacify his conscience by the delusion that he can do no harm if he takes no part and forms no opinion. Bad men need nothing more to compass their ends than that good men should look on and do nothing. He is not a good man who without protest allows wrong to be committed in his name, and with the means to help and with means with which he helps to supply, because he will not trouble himself to use his mind on the subject. Silence in the face of evil allows evil to thrive. And that's not to say that every person has to take huge, dramatic action steps. I don't expect every person listening to go and plan a protest on our behalf. But it takes very little time and effort to introduce yourself with your pronouns, to respect people's identities, and to increase your exposure to trans concerns and lives by following us on social media so that you can learn. Each of us can make a difference by having short, respectful, intimate conversations and connecting with people on a really personal level, and by challenging the assumptions that we make every day based on our hyper-gendered socialization. The trans community needs you, all of you. We are dying, and we cannot change society alone.
Thank you, Quinten. Thank you very much. Are there any resources you can share?
Yeah, so I've mentioned quite a few organizations throughout that provide support to the LGBTQ plus community. We'll definitely make sure that folks have links to provide more information wherever we post this video.
Thank you. And if viewers have questions for you, how can they reach you and how can they learn more about your program at East Bay Community Action Program?
So folks can always email my team at transhealthinitiative@ebcap.org for information, to ask questions, etc. We will have a section of the main EBCAP website at ebcap.org soon, where people can read all about the program and its subservices as they evolve. For now, folks can always reach out to me at the Health Center at 401-848-2160 and ask either for myself directly or for the Trans Health team when they speak with reception.
Quinten, thank you so much. This is really helpful as someone who is supportive, wants to be more supportive. I really appreciated the conversation about language. I would say from an ally perspective, we're learning. This is new to some of us. So I would say to my transgender friends, educate us with loving kindness. And I think trust that your allies have good intentions when you gently correct us. But I really appreciate this opportunity to learn more. I really thank you for doing what you do, your bravery, your passion, your integrity. I'm really glad we had this opportunity to chat and to get to know each other.
Thank you so much for inviting me. This was great. I'm so excited to see what other kinds of conversations that it sparks.
Great. Thank you so much, Quinten. Have a great day. And bye, everyone. We'll see you next month with a new topic and a new speaker. Take care.
Thank you.
Bye, Quinten.